Hi everybody, it's Dr. Freeman from Teton Raptor Center. I'm going to take you through this week's patient update. Our patient load has been static from last week, so I will take you through the patients that were not covered last week. First up is Bald Eagle 72124. This patient is a hatchier bird from Jackson, Wyoming, and was showing neurologic signs concerning for highly pathogenic avian influenza, or HPAI. This patient was put into our quarantine zone until they were confirmed negative for HPAI. On intake, this patient unfortunately suffered from hundreds of larvae inside both ear canals, which were manually removed and flushed. This patient did suffer a deep ear infection and was neurologic as a consequence. Overall, this patient has been progressing really well and has currently moved into our flight barn where we are working on teaching this patient how to fly and strengthening their pectoral muscles. The next patient is Swain Ha 727. Last week, Sheena was discussing in the patient update that this patient did receive an FHO, which again stands for femoral head osteectomy. To recap, this patient fractured their left femoral neck, which is depicted by the red circle in the x-ray. The yellow arrow is showing the right femur, which is normal. The next x-ray shows postoperatively what the procedure looks like. So essentially, we remove the head of the femur from the hip joint or the ball out of the socket. And the reason that the surgery is necessary is because a fracture at the neck of the femur is too unstable to heal and will always cause bone-on-bone friction, leading to horrific degenerative joint disease. We are really excited about this patient's progress, and we'll be publishing a case study in hopes that we can successfully rehabilitate patients with these injuries in the future. The next patient is Swain Ha 73024 from Rigby, Idaho. This patient was admitted to our hospital with a fractured left ulna and a fractured right coracoid. This patient has progressed really well, and as you can see in this video, is flying really well in our flight barn. One important factor that we need to consider for Swain hawks is that they're migratory birds. This species has already started their migration south for the winter, and some even go as far as Argentina. When rehabilitating these patients, we have to ensure that we release them when they are strong enough to make migration and before it's too late. Ideally, we would like to release all of our Swain hawks before the end of October in hopes that they do make migration. We do hope that this patient will be released very soon. The next patient in this week's update is Red-tailed Hawk 925 from Idaho Falls. This patient was in last week's update and was noted to have some minor soft tissue injuries to their legs. After last week's update, this patient's feet started to swell and turn purple, which is highly suggestive for an electrocution case. Unfortunately, it does take some time for the tissue to define itself, and what I mean by the tissue defining itself is that the tissue was dying due to a lack of nerve and blood supply and was turning purple, and you can kind of see that in this picture here. The overall prognosis for electrocution cases is very poor. There are very few reports of veterinarians having success with patients that have suffered from electrocutions, but typically their tissue does not die like this with successful patients. Unfortunately, we did proceed with humane euthanasia for this patient, and they did pass peacefully. It is important to remember that euthanasia is a treatment option and is a way that allows us to prevent additional suffering. Although this is a sad case, it is important to discuss the different treatment options and realities of wildlife rehabilitation. We thankfully can offer peaceful and painless passings for many of our patients that would have otherwise suffered immensely. On a happier note, the last patient for this week's update is Sharpshin Hawk 926 from Lander, Wyoming. This patient collided with a window and suffered from head trauma. This patient received oxygen and supportive care and has progressed well. This patient will begin flight conditioning this weekend and hopes to return them to the wild very soon. Thank you so much for tuning into this week's patient update. If you would like to support Teton Raptor Center, please click the donation link below. We seriously could not do it without you guys. And if you would like an additional update about a specific patient, please text us at the number below with the species number and the date that they were admitted, and we will get back to you as soon as we can. Thanks so much.